Are you looking to join or return to the NHS as a GP? Whether you have NHS experience or not, the Induction and Refresher Scheme is designed to help you get into NHS general practice. A career as a GP is challenging and diverse, and this scheme provides a supported, safe and direct route into the profession. Once you have checked that you qualify for the scheme and hold the necessary licences and qualifications, starting the application is easy, and there's practical and financial support available along the way. Based on your circumstances and experience, you will be placed on one of two routes, both of which are eligible for bursary funding of up to £3,500 per month for a full-time placement. There's also help with indemnity costs, other fees, and additional funding if you relocate to some areas of England. Whichever scheme suits you, there is a single point of entry, and you can get started online. Once you're registered, you'll get help from a dedicated account manager. Whether it's organising your placement or securing financial support, they will help guide you through the process and answer your questions. The Induction programme is for doctors who are qualified as GPs but who have no previous UK NHS GP experience. For example, Dr. Christophe, a French GP who is relocating to the UK. Christophe registers for the Induction programme by completing the application form. The Induction and Refresher lead will assess Christophe's clinical work and training, and if all requirements are met, recommend him for a placement on the scheme. This initial review will also help to map out a bespoke pathway for Christophe based on his needs. Along the way, Christophe will be assessed using a variety of methods, including a career interview review, which he can complete while in France, a multiple-choice questionnaire, which can be completed while overseas too, simulated surgery, and a supervised placement in a GP surgery with workplace-based assessments. Having passed all of his assessments, Christophe is ready to see his first NHS patients as a registered independent general practitioner. The GP Refresher programme is for qualified GPs with previous NHS GP experience who have been away for 2 or more years and wish to return to work as an NHS independent general practitioner. Like Sally. Sally has previously worked as a GP in the NHS but left a few years ago to raise her children. With the children now in school, she's eager to bring her training and expertise up to date and rejoin the NHS as a GP. Sally visits the website and decides she wants to register, so she completes the form. Quickly, she has a tailored scheme, including a career interview review, a multiple-choice questionnaire, simulated surgery, and a supervised placement in a GP surgery which can be tailored to meet her family and personal needs and will include a work-based assessment. In just a few months, Sally is back to working independently, having completed the scheme. Within the Refresher Scheme, a portfolio option is now available. This is for doctors who have previously worked as a GP in the UK and are now working in a similar role abroad but would like to return to the UK. For example, Samal. Samal qualified as a GP in the UK and worked for 3 years before moving to Australia. There, Samal worked in a GP surgery in Sydney. Now, 4 years on, he wishes to return to the NHS. Samal goes online and finds out that the portfolio route allows him to prepare a portfolio of evidence about his practice in Sydney whilst overseas. Following the guidelines, Samal works on a portfolio of evidence which demonstrates that he has maintained his skills and kept them up to date. He sends this off to the assessment panel. The panel evaluates his portfolio and accepts Samal to join the scheme. Samal then completes a 1-month reorientation placement in a GP surgery, which includes a short work-based assessment. All of these routes open the doorway for qualified GPs to be placed on the medical performers list, and once all approvals and conditions have been completed, they will be able to work as independent general practitioners. Whether you're new to the NHS or are keen to get back to general practice, we'll help you get there. To apply or find out more about the scheme, visit our website gprecruitment.hee.nhs.uk and click on the Induction and Refresher tab.